AM 1240 WGBB.com, and 1240 WGBB Freeport.
This is Healthy Living Radio with your host, Dr. David Scharf, a compelling program featuring today's top healthcare professionals. Join us as we explore the latest treatments and technologies to provide better care in today's ever-changing world of health and wellness. Now here's your host, Dr. David Scharf.
You're listening to Healthy Living Radio, dedicated to helping you live better, healthier, and longer. I'm your host, Dr. David Scharf. Thanks for tuning in tonight. Tonight we're going to have a very special show. We have a terrific guest tonight, Dr. Bonnie Helfner, a dentist in Commack. Bonnie, welcome to the show. Thanks for coming down.
Thank you.
I wanted to have you down to the show tonight because your reputation on Long Island is one of someone who has a really unique kind of dental practice. And I think most of our listeners have never really been to a unique dental practice. It's always been a humdrum experience a little bit. So I want to pick your brain a little bit about, what you do to make it special, how you develop the reputation you have, and let our listeners maybe know what are some of the new things that are out there in dentistry.
Sure.
So let's get started with where you went to school and you had some of your training.
I'm a local kid, so I went to Stony Brook undergraduate, and I went to Buffalo Dental School.
Mm-hmm. And then after dental school, you were telling me you did a residency as well.
Yeah, I was at Stony Brook, and they did it in conjunction with the Northport VA.
Mm-hmm.
So,
and how did you end up back in Commack?
As soon as I graduated dental school, I came right to back to Long Island where I did my residency, and my family ended up needing dentistry, and my father twisted my arm and said, you got to open up something here. He needed some work, and so we found a space right in Commack, and since then, that was in '97. And we just kept getting bigger and bigger, and so we kept moving down Commack Road until we found a bigger space.
It must be kind of nice coming back to practice where you grew up.
Yeah, it's great because my family's here. I grew up here. My kids go to school in the same community, where I did, and the practice is, right here.
I would think, as opposed to a dentist who practices, in one town and lives 30 miles away, you sort of live in the town where you practice. So your relationship with your patients must be very different than a dentist who practices, quite a distance away.
Yeah, I would think that it is. There isn't a place, I can't go any place without, seeing patients. And it's a good thing. Mm-hmm. I could be at Costco and people recognize me, and I'm at my kid's school. So it's nice, I see patients wherever I go.
Yeah, that is a nice thing.
Yeah.
Hard to remember their names sometimes, right?
It is sometimes.
You should make them all wear name tags all the time so you can identify them.
Right.
Yeah.
No.
How old were you when you knew you wanted to become a dentist?
As early back as I remember, I used to get in trouble a lot because I would rub toothpaste in the carpet on Saturday mornings. I don't know, I brushed my teeth all the time, and my father always remembers that I would get punished a lot for rubbing toothpaste in the carpet every Saturday morning. I don't know.
You made it up to him. You did all this dental work when you graduated.
Exactly,
right? So
right. We're even.
He made you come back to Commack.
Yeah, we're even.
In your practice, a lot of people have a lot of fear of the dentist or don't go to the dentist on a regular basis. And you've been in Commack how long now?
Since '97.
Right, so that's a long time.
Yeah.
And I'm sure you've seen a lot of people who've been away from the dentist for a long time, and then they sort of come back in. And what are some of the things that you think keep people away from being regular dental patients?
Well, fear is the biggest thing. Mm-hmm. I think their prior dental experiences, you hear stories from patients, when I was a kid, or, my old dentist did this. It stays with them. Mm-hmm. And so they just, that doesn't go away so easily. So, you have to try to do some things that put the patients at ease.
Mm-hmm. So. Do you think a lot of people are afraid of being judged, if they've been away from the dentist for a long time, that fear that the dentist is going to reprimand them like a child keeps them away even longer?
Yeah, definitely, without a doubt. I think sometimes patients are just embarrassed. And I tell them, whatever happened in the past, they're here now. Mm-hmm. So we're starting fresh. And, in my practice, we try to do lots of different things to alleviate those fears. Yeah. Because it's true. It's real. And, the way they've felt you've got to try to overcome some of those things.
So take me through maybe, let's say one of our listeners hasn't been to the dentist in a long time and they want to come in. Take me through what it's like for a new patient from the time they pick up the phone till, they finish their first visit. What that experience is like, because I know it's pretty different in your office compared to most offices.
Well, I feel like in my practice, we try to make patients feel like they are the most important thing. And there's no one that's more important than them. From the time they call to make the appointment, we try to make them feel like they're it. And to the time they walk out the door, where I call every patient at night, anyone that I give an injection to, or I personally need to sleep better at night knowing that the patient is comfortable with whatever procedure they had done that day. So, in my office, we have TVs in the operatories. We give whether it's kids or adults, sometimes, the headphones really will block out the drill or anything like that so that they're not focused on me and what I'm doing, but they're watching TV, and that's blasting in their head.
Mm-hmm. What about in terms of, talking to patients about treatment and helping them understand their treatment? What do you do in those respects?
Well, I feel like, sometimes in dental offices, it's hard because the dentist doesn't have a lot of time. In my office, I feel like I try to make the time. I sit with the patients. We'll talk to them. I will allow time, in my schedule. It's worth it to me to just spend the extra 10, 15, sometimes even longer, number of minutes just to talk with a patient and find out, what are they afraid of? What are their fears? What kept them away? Mm-hmm. What do they want to do? What's important to them?
Yeah. What's their reaction when you have that conversation? Because I'm guessing most patients have never really had a dentist sit down and want to talk to them about them as opposed to open your mouth,
right.
You have a couple cavities.
Sometimes I do get that. And at night when I call a patient, hey, how you feeling? A lot of times they're like, why are you calling? And it's just, I just called to see how you were feeling. How's everything from today? And, a lot of times I do get, I've never had anybody call. Mm-hmm. And then though my existing patients that know me forever, I'll call them and they'll say, we were waiting for you to call.
Yeah.
We knew you were going to call tonight. Yeah.
You have them trained.
Well, yeah, sometimes they'll just answer the phone, hey, Dr. Bye. So they're expecting it.
And that's it.
Yeah.
What are some of the newer things some offices have in terms of, relaxation or sedation for patients who just really are super fearful?
Well, for the super fearful patients, we do sedation dentistry in my office, where if somebody doesn't want to go to an anesthesia, an oral surgery office or, be put to sleep, we'll give them something at night, the night before an appointment, and the day of the appointment. So it'll just kind of, they're awake, mm-hmm. but it keeps them in a sort of a relaxed state where they don't really care what we're doing. Mm-hmm. And they need a ride home. They'll get a ride home with someone.
So they kind of come in, go to sleep, get all the dentistry done. And
yeah, they're not really sleeping. They're awake. They can hear us, mm-hmm. But they just don't, they don't care. They're not, anxious.
They're in a happy place.
They're in a happy place, yeah.
That sounds relaxing.
Yeah.
Sounds relaxing. Who's the typical patient that comes into your practice?
In my practice, we just have the moms, the dads, a lot of kids.
Do you like treating kids? Because I know a lot of practices, general practices especially, can't wait to get the kids out the door.
I do. I like treating kids. My associate likes treating kids. I have two kids. Mm-hmm. They're 6 and 10. My associate has triplets that are 9.
All 3 of them?
All 3 of them. I like treating kids. I like to give them, an awesome first experience. Mm-hmm. We've tried to do things in my office where, like I said before, we'll put sunglasses on them, the headphones, they're watching SpongeBob, the TV's right in front of their face. We have a no cavity club. We'll take their photo, we'll put it on a wall, they get a certificate. So sometimes also after we do treatment on a child, we'll give them prescription for Ralph's Ices. So we have that. We give them sometimes iTunes gift cards, anything to try to make them feel like they did a great job and they're looking forward to coming back for the next cleaning or something like that.
They must be excited to come back, I would think.
Yeah, sometimes we get kids that refer their friends, and we've actually had, like Toys R Us gift cards or Target gift cards that, we've given to kids that actually just, they'll say, hey, I recommended you to my friend. And, the 5th graders, the 6th graders, they're coming in because they're talking about it.
Oh, yeah?
So,
That's funny.
Yeah.
That's funny. What age should parents start to bring their kids to the dentist?
We say usually 3 is a great age, provided that there's nothing that they see before then, any potential issues. So 3 is a good age.
Yeah. And do you have a lot of people at the older end of the age scale, senior citizens? And such?
There's an adult community that's right up the road from my practice that we get a lot of patients from them, and so we've seen patients from 3 to 103.
Does that demographic have any sort of special needs? I mean, they grew up in a very different time dentistry-wise than someone in their 20s or 30s now. So what do they need that's special?
Oh, well, they need extra time. We have a chairlift, so they'll use the chairlift. You have to spend a lot of time and listen to them, because sometimes they just want to talk, and so you need to be patient.
They have great stories, though, sometimes, right?
Oh, yeah. I learn a lot sometimes just listening, to them. So,
what's the oldest patient you ever treated?
I think it was 101.
Oh, yeah?
Yeah, he's 101, and he's a patient over at Gerwin, and he's still there. He's still there.
My grandmother's at Gerwin. Maybe we can introduce them. They can play bridge.
He's available, I think.
Yeah? So's my grandmother.
Oh, gosh.
That's very good. I know the senior citizens, they sometimes need a little extra time, but...
Yeah.
And again, I think a lot of practices just don't take that time.
They have great stories.
Yeah.
They really do. And so sometimes, I'll make sure in my schedule I have extra time. And, I just sit there sometimes in my chair, they're in the operatory chair, and we're just schmoozing back and forth.
They must appreciate that.
I think they do.
Yeah.
Yeah.
Is, we got a little bit off track just talking about maybe things that keep people away from the dentist, and, you started to talk about fear, and you went into some of the things that you do, but what are some of the other reasons maybe, in your experience, people stay away?
Yeah, time. People sometimes feel like they don't have the time to come in and get a cleaning or a checkup. And, it's a matter of sometimes priority. And so, I think people you can make the time.
Do people have to take off work? Are there times when they make it easy?
Yeah, not in my office. We do have evening hours. We're there really late on Mondays and Thursdays and even Tuesdays, and we're there also 2 Saturdays a month. So there's plenty of time to come in after work.
There's no excuses.
There is no, really. There shouldn't be any excuses.
Yeah. And what else? I mean, you said it's not a priority sometimes, but, what other reasons do you think that people stay away? Well,
money is another reason that people tend to stay away. And, I certainly understand that. I grew up without dental insurance. It's a factor. But, there's always arrangements that can be made, financial arrangements. There's, financing options.
Would you say for the average patient that comes in with the average treatment plan that they can have a monthly payment that's maybe less than their iPhone bill every month? Or
definitely.
Less than they spend on cigarettes every month?
Oh, without a doubt. You know. But again, they need to, come in and inquire about it. Sometimes people just assume, I can't afford this, or it's not important enough to do that.
Do you think people usually think when they've been away from a while that it's going to be much worse than it is?
Definitely. And a lot of times I find that when I'm finished with treatment, I'll say to a patient, so how'd you do? How do you think it went? Much better than you thought, right? And it's always much better, way better than they thought.
You made a friend for life, probably, when you say that.
Yeah, and they love
They
it.
appreciate it.
I've gotten hugs, and it feels great. I've never had a patient say, that was worse than I thought. They always say, that's it? You're done? Or, I didn't feel that. Are you sure?
Lucky for us, people are very pessimistic when they go to the dentist, so their expectations are so low.
That's true.
That if they leave breathing, they usually...
they're happy.
They're usually happy, yeah. What else? What other reasons do you think people stay away?
Lack of trust. I think that, as you build relationships with dentists or with the dentist that you have, I think that the trust factor comes in slowly, and that can come with time.
Yeah. It's, years ago, if you just put on the white coat, people trusted you. And,
Right.
People sometimes change dentists and doctors so quickly now with their insurance changes. They always change somewhere else. They never develop that trusting relationship. And I think it really puts the patients at a disadvantage in terms of being able to make good choices about their teeth.
Right. Yeah, I think that that's why in my office we try to give them as much time, so, one-on-one with me and them, and even with the hygienist. I don't rush the patient with the hygienist when they're coming in for a cleaning. I think it's important that they feel that they can ask as many questions as they need to, so that they can feel comfortable.
Mm-hmm. Just to backtrack for a second, we were just talking about the cost of dentistry, and the economy's been so-so for a little while now, and it's probably going to be so-so for a while longer. And in your experience, is the most cost-effective thing for somebody, if funds are tight, to stay away from the dentist, or to kind of come and try and do some minimal maintenance work to try and prevent bigger things?
Yeah, well, another reason that people tend to stay away is, that there's no urgency. Mm-hmm. And so I do feel like, the worst thing you can do is stay away. Cavities grow, things get bigger, and with that comes the potential of pain and discomfort, and it costs more to do a bigger filling than a smaller filling. So I try to explain to patients that, it's bacteria, and it grows, and that's what a cavity is. So it shouldn't hurt you, and it shouldn't bother you. And the best time to get in is when something's not bothering you. Mm-hmm. So the best advice for patients is come in for the cleaning, for the checkup. We want to see you at least twice a year, just for that. And if we happen to find a cavity, it's going to be small, or it should be small, and then just get it taken care of. It's so much easier.
It's kind of like the person who never goes to the doctor because they're afraid they'll have something wrong with them. Like, going to the doctor is going to influence whether or not they have something wrong. It's going to be there anyway.
Right, exactly. Yes. And in dentistry, everything just kind of grows slowly over time. So we try to tell patients, don't just sit. Well, you get those patients that say, well, it doesn't bother me, I'm not going to fix it. That's not the greatest. You don't want to. I don't like that at all.
Yeah, it's hard. Sometimes they have to learn the hard way, I guess, which is unpleasant, especially when you've tried to, warn them and tell them.
Right.
So we're going to take a quick break, and then when we come back from the break, we're going to talk maybe about what's new in dentistry, new in cosmetic dentistry, and some things people can do, maybe some easy things they can do to enhance their smile.
Sure.
Okay.
This is Healthy Living Radio with Dr. David Scharf.
Okay, we're back. You're listening to Healthy Living Radio. I'm your host, Dr. David Scharf, and we're talking with Dr. Bonnie Helfner, great general dentist in Commack. She grew up in Commack. She went to school on Long Island. She's never crossed the George Washington Bridge, I believe. She's always stayed in New York State. So let's talk a little bit about, there's so much new in dentistry. And when I grew up, it was really, silver fillings in the back of the mouth, nothing cosmetic, that sort of stuff. And I think for a lot of listeners, maybe who've been away from dentistry from a while, maybe aren't happy with their smile. And, I would guess some people come in because they want to improve their smile. And so what are some of the things that people can do if they're just not happy with their smile or that sort of thing?
Well, if you're not happy with your smile, we offer laser whitening, take-home bleaching and whitening. There's a lot of different whitening systems that we offer.
Let's talk about that for a minute. I was in the mall the other day, and there's a huge whitening thing in the mall. So help me understand, or help our listeners understand, what's the advantage to a patient for seeing a dentist for having their teeth whitened versus, I don't know what those people are in the mall exactly.
I'm not quite sure. I've actually tried to ambush them a little bit in the mall.
But they recognize you. You know that girl who used to rub toothpaste in the carpet when you were on Saturday mornings.
No, but I actually did about a month ago. I was in the Smith Haven Mall, and I asked the girl, what's the ingredients in that? And she was like, bleach. Okay. She had no idea. And so that kind of stuff makes me a little nervous.
What does a dentist bring to the table? Let's say my teeth are, discolored, or I'm not happy with them, and I'm walking in the mall. Why should I go to a dentist to have my teeth bleached as opposed to having them done in the mall? I mean, beyond that, are the results as predictable from the mall? Are they trained to know what's going to work or not work?
They're not trained at all. Mm-hmm. They're not dentists. They're not hygienists. And no, I'm definitely skeptical. And I've had, friends and people ask, at least, in a dental office, we can give you different options. So if somebody says, I'm sensitive, my teeth are sensitive, well, there's a lot of different things that we can do to minimize the sensitivity, and then you can bleach. And in my office, there's 3 different bleaching systems that we offer, from the 16, 17, 18-year-olds that are going to the junior prom and the prom. There's just a minimal concentration, which, sort of like Crest white strips at CVS you can get, but a little stronger, to the laser system that I said, to another take-home system that they can try. It's just a matter of what kind of results are they looking for, how fast are they looking to get it.
So what does the laser do as opposed to the take-home kit or the white strips?
Well, it's really the same company. It's just the laser is much stronger. It's faster. And in 45 minutes under the laser light, you're pretty much done. You're going to be in the chair in our office for about an hour and a half, though, from the time we set you up. We take photos. We have to isolate the gums. And then we give you fluoride treatment to cut down any sensitivity that you may have. Whereas the take-home kit, it's for somebody who maybe can't sit that long in the chair. Maybe they have a gag reflex. So, or they just want to take it a little slower. They'll put bleach in the trays, and they could just do it for an hour while they're watching TV. It's a lot easier. I find men are much more compliant at home watching TV for an hour than, it's hard for them, I don't know why, sitting in the chair for an hour and a half.
They'd rather stretch it out.
I think so.
Is that the most common cosmetic procedure you think people come in asking for?
Well, with finances the way they are today, I think people want a quick, fast result. Another thing we do in our office are laminates or veneers, which is, like the Hollywood smile, if you will.
So tell our listeners what those are, because people hear that a lot, but I'm not sure that they know what that means.
Sure. That's little porcelain shells that go on the facing side of the teeth, and they're actually bonded. And once they're bonded, they're extremely strong. But they're, anywhere from a half a millimeter thick to, just a millimeter thick. So they're very thin and fragile, but once they're on, they're bonded, they're very strong.
What's the process like? Let's say a patient calls up and they come in and they've been away from the dentist for a while. Their teeth are, unesthetic. They're chipped, they're yellow, they're old, ratty. And they just say, hey, my friend's been coming to you for years. I heard you're a great dentist. I want you to fix my smile. What's that process like in sort of designing the smile and making sure before you start that they're happy with the result at the end?
Sure. Well, what I like to do in my office is, we'll talk to the patient. I'll find out what they're looking for, what kind of cosmetic result they're hoping to achieve, what they like and what they don't like currently. So I'll document all of that. I'll have them take photos. We'll take pictures, side profiles, and face on. And I'll sit them in front of the computer, and I'll show them some cases that we've done from start to finish, just so that they know, this is what the process is. This is how they're going to go home wearing temporaries. And then we send off impressions, photos, and any information that I've discussed with them as far as what they like and what they don't like to the lab. And from the lab, I get something called a Diagnostic Wax Up. And that'll come back, and it'll show the patient, this is what it could look like in wax. This is what you currently have. These are your models. And you see how the teeth are crooked or they're malpositioned. And this is the wax up. And this is what it could look like. And it allows the patient to see, I like the shape. I'm not sure I like the size. And so we'll play with the wax up. And the wax up, once they approve it and they like it, I will use that to help me make my temporaries. So when they come in for a big, long appointment that day, we prepare all the teeth at once. We take an impression, and they go home wearing temporaries that day that mimic the wax up. So
they look better that day?
They look much better that day. And I try to tell patients that, and, it's hard because it's a big treatment, but they always look better in the temporaries than when they first started.
What do people say when they see that wax up? I would imagine they're surprised just from that most times.
Yeah, they are. And, So that's why we take before and after shots, so that they could really appreciate what they had before, and they're just amazed.
What do people typically say to you when you finish those cosmetic cases?
Well, they're all very happy. They're just ecstatic. They can't stop smiling sometimes.
Do they say, "Boy, I'm glad I waited all this time to fix my teeth"?
No, but really, a lot of times I hear, I can't stop smiling. A lot of the patients, I remember one particular boy who he was just early 30, had never smiled, always put his hand in front of his face when he spoke, and he got over some drug abuse issues, and because of that, tobacco and things like that, his teeth were really ratty, as you said before. And it's a great feeling for me because he's young, he got married, and he had to learn, he told me, to keep his hand down.
Oh, yeah?
Because he was so used to keeping his hand up over his face. So that's what I love the most.
It's probably one of the most satisfying parts of being a dentist.
It is. For me, that's the best. Mm-hmm. When you change somebody's smile and they're so appreciative, and then they can't stop smiling.
I mean, it sounds corny, but for some people, you change their life.
Yeah, absolutely. To me, I don't feel like it's corny. I love that.
Yeah. What's the oldest patient you ever did cosmetic dentistry on? It's the guy in Gerwin.
We did a whole veneer laminate case on someone in their mid-60s who was getting married a second time.
But there's no age limit. I mean, if their teeth are healthy and they're healthy and they want better looking teeth, they can have better looking teeth.
Absolutely. Yep.
That's got to be a good thing.
It is.
It's got to be a good thing. What do you think, when people are thinking about cosmetic dentistry, that sort of keeps them on the fence? Because, I mean, it sounds like if you could somehow show them what their teeth would look like when they're thinking about it, probably many more people would do it. But what do you think keep people on the fence for so long before they finally decide to go ahead and fix their smile?
Oh, I think finances play a big part.
Yeah.
Yeah.
And with those cases, can they sort of finance them and spread them out as well?
Yeah, absolutely. We have different financing options in the office that, I have the best practice coordinator, and, she could review it and go through it with them and make nice, different options for them.
Mm-hmm. And I would guess there's always different options. I mean, it's not always one way or the highway. There's,
right.
A, B, C, D, and you can...
There's always choices, and, we try to work it out with patients, whether it's the large laminate case or just the single crown, so we try to work it out with the patients to make it comfortable for them.
I guess sort of practicing where you grew up, the community, the people, you see them all over the place, and
right.
It's probably uncomfortable to see someone somewhere that you didn't click with, so it's even more motivation to make it work and make it a positive experience for them.
Absolutely.
Yeah. So if anyone's listening to the show that wants to get in touch with you, maybe you could tell us where you're located, if you have a website, your phone number, that sort of thing.
Sure. We're at 645 Commack Road, close to where the Commack Multiplex used to be. And the office number is 631-858-9800. Mm-hmm. And the website is www.bonniehelfnerdds.com.
That's excellent. And you have an associate too, you said?
Yes, Dr. Jen Rubin.
Uh-huh. And how long has she been with you?
She's been with me 3 years. We actually went to Buffalo together. So that's where I met her up there 19 years ago.
You both have a love of snow, deep snow.
No, I don't have a love of snow, but I do love Buffalo. It was really good.
Yeah, it's a great school.
I enjoyed it.
It's a great school. Well, thank you for being on the show tonight. I really enjoyed the show. I think our listeners learned a lot.
Thank you.
And can I have you on another night?
Absolutely.
Fantastic.
Thank you for having me.
Thanks for being on. You've been listening to Healthy Living Radio. I'm your host, Dr. David Scharf. We'll be back on next Thursday. Thanks for listening.
You've been listening to Healthy Living Radio with your host, Dr. David Scharf. Join us next week for another edition of Healthy Living Radio.